This is a video of a NeuroLink app that's at this moment on an iPhone, but it's will be available for Android as well soon. It's a free app one can download. It's called NeuroLink that allows a patient to do self-assessment of different symptom categories. There's 8 different symptom categories with general symptom checklist. In this case, it has 33 because it's shortened, but it will have 52 different questions. It could be pain, autism, alexithymia, which is social problems, not being empathetic and understand the meaning of facial expressions, early dementia, concussion, Parkinson's, and then we also have an app. A questionnaire for the coronavirus, looking at the severity of symptoms, the length of symptoms, the risk factors, etc., that somebody can fill out and give to a clinician when the patient is at home at a distance from the clinician. Clinician can get this information from the patient. The patient can keep it themselves to look at how their symptoms are changing as a function of time. I'm just going to take this general symptom checklist, in which starts with a explanation of what it does. And there's 10 different networks in the brain, because what we're trying to do is link symptoms to dysregulation in a patient's brain. So we're going to click continue. For example, the first one, having cravings for alcohol or drugs. I'm easily distracted. Say if I click often, that means it's going to be attention network. People usually have to repeat words to me. I have blurred vision, etc. So I'm going to quickly go through these. I feel sad and blue. I feel anxious. And you rank them never, rarely, sometimes, often, and always. So you're ranking in a self-report the severity of these symptoms one by one. And if a patient does this honestly and accurately, and they almost always do to the extent they can, then they'll get through this. And now it's calculating with the graphs of what is most severe. In this case, depression is more severe. He's got low, moderate, and severe severity. That's the depression network. We can manipulate that and look around. These are the hubs and nodes of the depression network as determined by functional MRI, PET scans, EEG, MEG, SPECT scans as part of the human brain mapping program that started in the 1990s in the Human Brain Mapping Initiative at the National Institutes of Health. This is the cortex. You can remove it. You can go up and down with this wiper to evaluate and you can scan and increase the size of the hubs and network if you wish. And you can look at there's memory network. You can look at different networks. And here's the anxiety network, for example, etc. You can put the cortex back in. So that allows a clinician to see, and the patient to see the severity of their symptoms and also the hubs of the network which are contributing to those symptoms inside the brain. That allows the clinician to then target those hubs, link to the symptoms and link to the patient's brain, and then using biofeedback or whatever methods they want to try to move the patient towards less severe symptomology. These are just repeated tests on a radar map. The goal here is to have these tests or have the severity collapse towards 0 in the center. So the farther it is away from center, then the more severe the symptoms. You can click information. This gives you information about the attention network or anxiety network. Go back to the graph. You want to find something about depression, then click info. Here's the depression network. This is information that can be obtained from the National Institutes of Health and the National Library of Medicine. So one can evaluate. Here's pain network. The pain network is not severe. That's why it's low. But one can also still evaluate what the pain network is and look at these different components. Then one can also get connected to a clinician on this map. The clinicians will subscribe to to essentially applied neuroscience. Even though the app is free, the clinician will have control over which tests the patient will be able to take. The general test will be available for free, but the specific ones will be worked out in cooperation with the clinician, whether it's urban or rural patients, so that they can be treated at a distance safely during this time of the coronavirus. You can get information about NeuroLink by clicking about. You can visit the clinics themselves, so certainly get in contact with the clinician. And then the clinician has NeuroLink Pro, which the clinician using TeamViewer, GoToMeeting, Zoom, or the internet communicates with the patient, teaches the patient how to apply electrodes to their brain. It can go from, to get the networks, you'll have to have 19 electrodes with a cap. But this is home training. It's commonly done in the field of EEG biofeedback. Other methods than biofeedback can be used, but then the clinician will target the patient's network hubs that are linked to the patient's symptoms and reinforce greater stability and efficiency in those hubs to reduce the severity of the symptoms over time, and then plot those severity symptom changes using the graphs that we showed before. So this is a quick example of a smartphone. As I said, it's going to be free for people anywhere to evaluate their severity. We'll have it on multiple languages as well in the future, but we're trying to step forward to address this serious problem right now that's going to be around for a while, with home training and distance communication between clinicians and patients who had a pre-existing condition, and PTSD, and depression, anxiety, etc., can now be helped safely without putting other patients at risk or the healthcare provider at risk. So thank you for watching.